Well, hello. This evening is Tuesday, March 21st, 2023. I am Dr. Ellithorpe from Tustin Longevity Center, and this is Ask Me Anything, the doctor, and at Tustin Longevity Center. We're a group of physicians who are healthcare providers that have been doing functional medicine for a long time. We do the uh, natural hormones, chelation therapy, uh, fasting, intermittent fasting, forward-looking cardiovascular profiles, anti-aging medicine, along with our standard medical training. And we work to improve the immune, nutritional, and promote the detoxing of your body. And with that, there's 7 of us at this point, and we really enjoy doing this. It makes healthcare fun. Now, we have been doing this program, Ask the Doctor Anything or Talk to the Doctor. You can put in your chat questions if you're on YouTube, type them in. You can also email in your questions. So quite a few of you have emailed me questions. If you're on our email service, you can go to office@tlcdoctors.com and ask to be on our email. You could call 714-544-1521 and ask to be on our email. And if you get an email notification of these Ask the Doctor Anything question times, we meet Tuesdays at 6 o'clock to 7 o'clock all the time. And we're doing this as a service to our patient. We've been doing this for several years. And we are trying to open this up to family, friends. So if you find value in this, you can share and like. That helps us with our outreach. You can write a comment, or I do try and look at the comments and answer commentary questions and so forth. So you can write a comment at the bottom. At the bottom here is a see more link where what we're trying to do is keep the emails that we collect for these meetings separate from emails that come to our standard office regarding our patient care. It gets, so to say, mixed in. So we might miss your questions. So in the link below is a way for you to connect with that. Or when you get an email, hit the link there and it'll go directly to a bin for Ask the Doctor. So with all that said, we will say happy spring. Spring has sprung, and we'll get to our email questions, and then we'll go to our chat questions. I was just listening to a lecture by Dan Wigington, who runs geoengineering.org. And about 10 days ago, he was talking to a chemist who is now retired, but he does environmental studies. And they had a sample of the recent snow on top of Mount Shasta. And in it, you'll see that the assay of heavy metals in the snow, aluminum was 161,000 parts per billion. 161,000 parts per billion of aluminum that was in the fresh snow on the top of Mount Shasta. So we are being exposed from the sky to chemtrails, and they are putting hundreds of tons every year into the sky of these nanoparticulate aluminum oxides, strontium oxides, barium oxides. This is hitting the land. It's getting into all our food and our water. When it dries out in the forests, it becomes an accelerant for rapid spread of fires. That's why fire seems to explode so fast. But can you imagine that, 161,000 parts per billion? Well, fortunately, we have EDTA chelation that we can do, and do it on a periodic basis here. We do walk-ins as well. So if you're interested in looking into that, go to Dan Wigington at geoengineering.org and look up the Mount Shasta aluminum count. And that was put out about 10 days ago. I think you'll enjoy it. Now, let's see. Let's start with Jackie. And it says, hello, if you think that you may have been damaged by statins, the weakness, tingling, some numbness, do you know about how long to expect it to take to recover? And can the symptoms come and go? So these statins work to inhibit an enzyme that's involved in the part of cholesterol, which is a very important part of our cell membranes. Remember, I think if I can turn this a little bit so I can show you this video here. If you look at this right here, you'll see right here is a cholesterol molecule. If you see right here, it's a cholesterol molecule. Here's a cholesterol molecule. This is the protein transmembrane molecule. And these are essential fatty acids snuggled up to it, your linoleic, alpha-linolenic acid. And you have to have cholesterol in everything. So to blame cholesterol and to be treating cholesterol as almost the number one pharmaceutical prescribed is misunderstanding how important cholesterol is to our skin, our health, and the membranes of every cell in your body. Those membranes are felt in the muscles because there's so much wear and tear on our muscles all the time. So we get a lot of what we would call myalgias and pain feedback syndrome. Sometimes people will even get liver enzyme elevations on statins, but others will also have the sense of tingling neuropathies in the hands and feet from statins. And this is because the myelin sheath that surrounds the nerves requires a lot of fat to be the insulation of our lining along each nerve. And if that is not formed correctly, because you don't have enough wonderful fats and cholesterol being part of that to help construct the myelin sheaths and our cell membranes, then these little damaged sites, if you can see this little poke of hole poked in the membrane there, becomes irritated, and that will conduct a transmembrane electron potential that's abnormal, and it won't transmit information correctly. We have to repair it by eating cholesterol-rich foods, which are animal products, eggs, chicken with the skin on it, meat, fish, your crustaceans, your shrimp, your lobster and stuff. You've got to do all that and eat it and digest it so you can help assimilate these blocks into your body for healing. So the answer is, how long will this take to repair? Well, if you don't eat enough cholesterol-rich foods, it will take a long time. If you don't get enough alpha-linoleic acid in your body, the 2 human essential fatty acids, it'll take longer. And so I would move toward a carnivore diet. I would use a low-carb diet because that will promote the microcirculation that gets into the tiny, deep tissues where the cells are that are needing all these building blocks brought to them. So then you should see improvement develop quicker. Now, usually nerves take years to heal, but I have seen people, along with EDTA chelation, we just brought that up about the Shasta Mountain aluminum particles per billion. Heavy metals also aggravate these neuropathies because they help to disrupt the electron transfer chain potential. So that would also accelerate healing if you use that. Hopefully that helps you and gets you some information, Jackie, on that. Barbara says, Dear Dr. Ellithorpe, thank you for everything you are doing. I am a 74-year-old woman and had a dental bridge for years. Last year, the bridge came loose, and when the dentist removed it, one of the teeth had broken and had to be pulled. I am being told that the best option is to have 2 implants and that a 4th tooth bridge isn't an option. What do you think of dental implants? And she goes on to say, also, my dentist has retired. Do you have referrals to a dentist you recommend in the Orange County area. God bless you. Well, thank you for those kind words, Barbara. The dentists, I would look up, they are called biological dentists. These are a term that have been attached to dentists that are functional. They're trying to do things naturally. Many of them, when I did my doctorate in integrative medicine in 1999 and 2000, there were several dentists there, and one of them still remains as a friend to me. Dr. Leo is here in the area in Irvine, Laio, and and then Dr. Sun, Son, is in Newport Beach. Now, Dr. Sun is very aggressive in his natural therapies and alternatives. And Dr. Leo, who I went through the doctorate of integrative medicine after medical school, he also does natural work, but he doesn't do as much as Dr. Sun, Son, who's in Newport Beach, right by John Wayne Airport there. So those are two that are in the local Orange County area. I'm sure there are more. I just haven't worked with others because I had these two all the time, and they're excellent. Now, what do I think of implants? If you can't have a bridge and you need an implant, it becomes challenging in the sense that you need to have good bone. So you should take your vitamin D with K2. You should bite on some hard plastic or something in the meantime to get that shake in your bone structure here, your mandible and your upper bones to help build it. Some people have a plastic thing that they gnaw on. They have it as a necklace and they just chew on it, not like a pacifier. They literally bite down on this hard rubber, and that helps to, so to say, exercise the bone in your mandible. So vitamin D, exercising with a good hard bite, and the other thing I would say is there are acrylics now that are the actual implant that is drilled down in, and then you wind up not having so much of the heavy metal risk of the former metal implants. So there are now acrylics that seem to be superior. So I am in favor of talking with a specialist, Dr. Sun and Dr. Leo. I hope I'm saying his name right. But they would be the best to ask because I don't do this a lot. They remove a lot of those root canal scenarios that usually harbor, without any pain, asymptomatically, they harbor bacteria in your bone of your jaw. Terry says, hi, Dr. Rita. What are your thoughts on a vibration plate for lymph node drainage and other health issues, joint soreness? I'm familiar with those vibrational plates, and I haven't been impressed with them. I haven't seen continuing references to them, studies on them. So if it isn't brought up, I mean, sharp doctors out there who will pursue things, and if they are effectual, they'll stay steady. Like EDTA chelation has stayed steady throughout all the decades as one of the most unique, life-extending, heavy metal reducing, microcirculation promoting interventions that you can do. Whereas these vibrational plates, I have not. I also know that there is not enough money and activity to support research. So I don't want to tear something down if there isn't enough money to do research on it. So what I like for lymph is the rebounder. That's that mini trampoline, maybe a 3-foot diameter, and you just bounce on that. Some of it has a bar on top of it if you're older and kind of imbalanced. That mini trampoline and the lymphatic massage is absolutely superior. So I would go down that road, Terry. Then Tara asked this question: what are your thoughts on resveratrol supplementation. All right, so resveratrol is one of many, many antioxidants that are in the dark red berries. There are so many different phytochemicals in these fruits and vegetables and such. We don't know all of them. It's just whatever happens to be the most intriguing. And so since there's some research on wine and what's in it and the composition for enhancing wine, they came across resveratrol. And you would have to take enough wine. So if you think drinking wine is valuable, I think there was something like 1.9 milligrams of resveratrol in a glass that I think is about 6 ounces of red wine. Now, but to be therapeutic, you would have to have 1,200 milligrams, which means you would have to have 600 glasses of wine. You'd be dead by the time you drink that much wine. So you can't use the excuse that it's good for you. This is foolishness to say wine has resveratrol. So what we would suggest is appreciating God's design for the vast variety of humanity and creation that is out there. And then even in the fruits and vegetables, there's such a vast variety of phytonutrient chemicals that are all designed to be picked and shopped on by your gut and intestine and absorbed as your body needs it. That's why I think buying and taking just individual nutrients is kind of not the direction I would go. We try and say, instead of drinking a protein powdered shake, try and learn to eat a healthy diet. We try and say, try and learn to do intermittent fasting or fasting for 24, 48, 72 hours instead of buying ketone supplementation. Because it's not natural to use supplements for ketones. Not that we have found any real harm in it. It's just we don't know it all. And part of being I think a good healthcare provider is to have that humility and that wonderment at the creation of man. So to make a long story even longer, I am not for resveratrol as an individual supplement. So there you have it. Harlow says, blessings, Dr. Rita. I'll receive all your prayers and blessings, that's for sure. My daughter in her 30s was just diagnosed with myocarditis. After 3 scary heart episodes, she was told it was probably from a stomach virus her son had. That's unusual. I think it is the vaccine related. I tend to have a favorable opinion of what you just wrote. And then she goes on to say, what are your thoughts and recommendations to bring down the heart inflammation? And will she have a normal life? I'm supposed to have a dynamic MRI pelvic with contrast for a retrocele diagnosis. Is this even necessary? I have been doing chelation to clean the heavy metals out. Is this going to put poisons in my system? Why would a teenage girl get a fibroid adenoma in the breast? How can this be prevented if prone to getting the disease? So 3 questions. So regarding your daughter who received the mRNA gene therapy injected into her, we would say one of the best ways to try and heal is to do fasting. Fasting will absolutely reduce inflammatory molecules because it gives the body time to heal, and that means disinflame. Drinking enough water, half your weight is ounces. Taking systemic enzymes like Vitalzyme or Vascuzyme on an empty stomach 2 times a day, maybe 3 times a day. And those enzymes work as anti-inflammatories. Even doing chelation therapy, the EDTA molecule is an anion, and the spike protein is a cation in its pharmacokinetics. and it has a net positive charge. So EDTA chelation also has the ability to reduce spike formation. And now we know years now and months after the mRNA gene therapy injection that we don't know how far it distributes in the body. We don't know how long it can take over the mRNA, impacting the transcription of your ribosomes and start producing spike protein. So that could go on and on. So what I would say is enzymes, water, low carb, fasting, chelation therapy. I would use quercetin also. Quercetin of a high quality over the counter. Ours is D-hist, and there's over 200 milligrams of high quality quercetin in it, in each capsule. And I would probably use at least 3 a day to be effectual. And that works as a antiviral, anti-inflammatory. And then of course we would support vitamin D supplementation and a good multi-mineral. Now, the other question you had is how long will it last? And will she have a normal life? I want to let you know that I was diagnosed at 15, 16. I was hospitalized 4 months. I was in an ICU for heart, and that was in the early development at Election Brothers Hospital in Elk Grove Village, Illinois, because I was in the northwest suburbs of Chicago. There I was hospitalized with this terrible fever and sore throat, and I wound up having EKG proven abnormalities, and it turned out I had a viral panmyocarditis. It was so severe, back in the 1960s, you could have died from that, and the likelihood is death back then. And I survived it, and then I got so healthy that I passed the ROTC, physical, military physicals, and the flight surgery physicals, and had babies. Everything was normal. But my father got me EDTA chelation therapy. My father got me high-dose vitamin C infusions and injections, and he had me on vitamins, and he controlled my diet, and I just recovered because I was just laying there in bed with a heart that was going flippity flop all over the place. And I think my father really intervened. I don't think the doctor knew what my dad was doing. But anyway, that happened to me. And by the way, the one doctor who gave me EDTA chelation is Dr. Ray Evers. Dr. Ray Evers is the physician. I think he was in Alabama, Andalusia, Alabama, if I remember, my dad driving me down there, or my mom. I was hospitalized there after I was released after 4 months from the Elk Grove Village St. Election Brothers Hospital. And what they did was, that's where I got all the chelation right away. And Dr. Ray Evers was such a wonderful, good doctor. I don't know, maybe he had compassion on me because I was just a punky kid. And he took me to church with him. And that impressed me all the days of my life. Later, as I got married and finished, college, I sought him out for advice for medical school. So that man had a great impact on me. But I want to say Ray Evers is the doctor, all of us physicians around the United States, we honor this man because he brought to Congress the argument that a doctor has the right to use the off-label use of an FDA-approved drug in his judgment, however he wants to use it. So off-label use is all due to the hard work of Dr. Ray Evers. And I was so humbled to be his patient and helped by him with EDTA chelation therapy. All right, and your last question, you're going to have an MRI. Yeah, that's going to put gadolinium in you, but it will give tremendous information, high quality information. So I'm not necessarily against it if you need it. And just keep on doing the chelation. It'll pull that bad gadolinium out. And then the third question was, would a teenage girl get a fibroid adenoma in the breast? How can it be prevented? Well, iodine deficiency is highly associated with fibrocystic breasts, benign prostatic hypertrophy, fibroid of the uterus. Um, Metabolism is messed up when we don't have the things we normally would get. And so iodine has been replaced in all our baking goods with bromelain. Bromelain is horrifically terrible. It's cheaper, and fluoride is horrible. It's in the same elemental group as the halogens with iodine and bromine and chlorine. So she probably is iodine deficient, and she probably needs progesterone days 15 through 25 of her menstrual cycle. A lack of progesterone will leave you in an estrogen dominant phase where the growth of the glands of the breasts will just be unopposed and give you cystic breasts. The high carb diet of the American system, it will stimulate the hormone insulin. Insulin will aggravate the breast by overstimulating its growth. And so if you do those things, and if you take systemic enzymes like the Vitalzyme or the Vascuzyme on an empty stomach, that will help her also. Hopefully that helps, Harlow. Victor says, what nutritional supplements do you recommend to help with dermatillomania or excoriation disorder, a skin picking disorder where you cannot stop picking at your skin? That's a multidimensional issue. I think it is a gut issue. I think actually the gut is trying to tell the person that their bacterial flora is imbalanced. The good flora that would make the healthy B vitamins that will help you make good neurotransmitters, which will help you have a healthy, calm brain, are disrupted. Vitamin D levels are so low in the population. It's rare that I ever see a person come to me with normal, healthy vitamin D levels. And vitamin D helps with your gut milieu in supporting healthy bacteria to stay dominant in the gut. So I think this is a long-term dysbiosis of the gut from our high carb processed food lifestyles. Essential fatty acids, taking enough parent essential oil, clinician's preference. I would take a double dose of those oils. I would try to eat a lower carb diet. I would begin an exercise program no matter how you feel, no matter how weak you feel, and just start exercising. I would eat more protein with the fats and butter and cholesterol to build this up. And then you have to have your blood type done. I see this case in blood type A's more than any other blood type. And then this multi-mineral replacement, magnesium is calming and relaxing. And then I would look at their hormones. If they're a male, of course, their hormones are different from the female. And that's the direction I would go on that, Victor. Dorothy says, what is the most absorbent, effective form of magnesium? Well, I think they're the amino acid chelates, which Albion, the company Albion makes. That would be any amino acid linked with the, the nutritional metal magnesium. So it'd be magnesium glycinate, magnesium citrate, magnesium malate. These all are very well absorbed. I think they are even making a magnesium threonate now. But I don't think any one is better. I think as long as they're all connected with an amino acid, you're going to get very good absorption. Constance says she needs help with sleeping. She's 70 years old, fit, low carb, no medicines, intermittent fasting, no alcohol. She leads a healthy life. She stops drinking water around 3 p.m. She goes to bed around 9, but she's up to urinate 4 to 6 times a night. So you get 2-hour sleep segments. Also, you have tried eye mask to make sure it's blacked out. Sleep is so important. Praying for an answer. Thanks for all you do. I think what I would say, Constance, is I would look at a sleep study. What we're finding is you don't have to be fat and bulbous and with 3 triple chins to have sleep apnea. You could have what we call disrupted sleep apnea, and this wakes you up, and then you think it's your bladder. And what is causing that? You're not getting deep enough REM sleep. So, in this reading of a sleep study, the phases of going into sleep, the deep REM phase, and then there's a superficial REM phase. If you're not getting into deep REM, you're going to be easily aroused. So, why would you not be going into deep REM long enough? And they're linking this to vitamin D deficiencies, also the biofilm in the gut, and the lack of pyridoxine, which is vitamin B5. Now, you can't take high dose B5. In fact, most people will probably take excessive amounts of the water soluble B vitamins, but I would think, a 50 milligram, 8 of the B vitamin complex methylated form with vitamin D somewhere in the realm of 10,000. And start doing that with a good amino acid linked multivitamin. We have the TLC multimin. Start there and see if with vitamin D, and check your levels. Some people need to get up to a vitamin D at least 80, 100 before their REM sleep improves. So try that is what I would suggest, Constance. May the Lord give me wisdom and insight on that. All right, the next one is Liz says, hi, Dr. Ellithorpe. My son who took the jab is experiencing rashes and flu symptoms frequently. When he goes to the doctor, they simply tell him he has a virus and they can't do anything for him. He's having a hard time functioning daily. Besides doing chelation, what else can he take? I would go on a preventive dose of ivermectin, probably if he's a young man, adult size. 18 milligrams is pretty typical of a compounded capsule, 18 milligrams twice a week. He could start out using it once a day for 5 days, then go to twice a week. He needs to make sure his vitamin D level is also up in that 80 range and get it measured with a doctor with labs to do a chemistry and check his liver enzymes. He also probably needs to find out what his blood type is so he can know whether or not he needs to use digestive enzyme to help him extract from the food the things he needs. Because vitamin A is a fat-soluble vitamin. Many times we're getting into these diets that are just so weird and limited that the vitamin A is important on so many levels for brain health, sleep, eye, vision health, and your pineal gland. All these things. It's never isolated. So. Quercetin would be the thing I would give him. Also, if you don't do ivermectin, I would give him 800 milligrams of quercetin. You could do both together, and then get that multimineral to get the zinc level up. Tell him to watch his carbs, his soda drinks, his juice drinks. Don't do juicing. And I would be on a B complex 50 milligrams, no more than 100 milligram range on the B vitamins. He should pull out of that though. Let's see, what's the next one? Asia says, hi, Dr. Ellithorpe. I have 2 questions. What are your thoughts about ozone therapy? Also, how possible is it for a potassium deficiency to immobilize someone and cause sudden death? Well, it could definitely. I mean, that's one of the ways you can kill someone if you want to, is to inject them with excess or the opposing agents of potassium. Potassium is a very critical element in the transmembrane energy potential for the life of the cell, the energy of the cell. But what are your thoughts about ozone therapy? Let me take a sip. We do ozone therapy here. We do it with ultraviolet light irradiation with UVA, B, and C to kill viruses. And the ozone is injected into your own 50 cc's of blood. And then we put the ozone in it. And then we let that reinfuse back into your body through a line that has the light circling it to kill viruses. It has been well studied throughout the world. I remember doing the doctorate of integrative medicine. Ozone therapy is used quite aggressively since the 1950s for all manner of viral illnesses and molds and toxins. So I'm in favor of it. That's just oxygen therapies. So yeah, there are people who do hyperbaric oxygen therapies. There are people who do ozone therapies. You can insufflate ozone, through various methods. So there's all kinds of ways to use oxygen in therapies, and I'm in favor of it. But you need to be trained. And then Asia went on to say, I am inquiring because a friend of mine was experiencing cramping in his legs and hands and lost the ability to lose his legs. He went to the hospital and was told it was possibly a potassium deficiency. He was in the hospital for 2 weeks and died. He had taken the injection of the mRNA gene therapy and boosters. I'm so sorry to hear that. I don't have anything I can say with that much knowledge. But if these spike proteins are the pathologic component of the coronavirus infection, and the mRNA gene therapy is taking over your machinery to produce them, and how long and how much we don't know, then you're taking in a pathological viral particle that can create oxidative damage, which will be poking holes in your cells. And when you poke holes in your cells, you leak out all this potassium because there's a pump across that cell membrane. That cell membrane right here, they have pumps, and they pump out hydrogen, and they pull in potassium, and there's a very delicate phase there. And if you have a lot of holes poked in them universally throughout your body, then you become hypokalemic, and then you go into arrhythmias and you die. All right, next question. Jean, another integrative doctor told me since I've had a history of kidney cancer, you were cryoablated and MRI shows gone. I still should not take supplements with iron, copper, or glutamine. Do you agree? Do you believe in the old cancer treatment of SCFT? Thanks. Well, I don't know what this integrative doctor is referring to. Now, iron in a postmenopausal woman or a man supplementally is probably not the right thing to do. Menstruating women have a need for more iron so they can take it. So he's probably saying if you're past menopause, nobody should be supplementing with iron. So I can understand that. Copper, it's hard to be copper deficient. You could harm your copper balance by overzealous zinc supplementation. So I don't have any of my patients taking any more than about 20 milligrams, 25 milligrams of zinc a day. Some people have gone nuts with taking zinc, and this can offset your copper. Now, glutamine, Well, glutamine is one of the amino acids that can be metabolized by cancerous cells that are in a fermentative facultative state of anaerobic metabolism, meaning they can burn sugar without oxygen and metabolize it into pyruvic acid and these other things. So glutamine is one of the other choices outside of glucose. So that's probably why I said glutamine. But I wouldn't worry about it. And yes, ECFT has these antioxidants in it that are very valuable. So, but as a treatment alone, no. I think the low carb diet is the right way to go. Jean goes on to say, my B12 levels are always off the chart high. My DNA test by the DNA company showed I needed folic acid, not methylated. Do you agree? No, I don't agree. I really don't. It's methyl. The body uses methyl folic acid. All right. I also have COMT, and that Cell Science said I am never to take quercetin. What do you think of that? Well, I don't think of much of Cell Science then, okay? So they have little test holes, and their testing ability and their tools are limited. The body is far more adaptive, so that's foolishness. Chris says, I've been hearing lately that vitamin D3 is a steroid and not really good for you. Well, I would expect that to be said because it's so wonderful for you. I'm talking about the synthetic form of vitamin D3, not when you get it naturally from the sun or food. Have you heard this? Is D3 dangerous in any way? Let me put it this way, Chris. It's not even a fraction of the danger of living on a low level. So I think if you're taking supplemental vitamin D, I think it's safe to take up to 5,000 international units of vitamin D3 a day. I would see your doctor and I would get a blood level done with a chemistry to look at your liver enzymes to make sure they're not elevated and do it fasting. And so that's all I'll say there. Vitamin D is involved. It's really a hormone. It is from the cholesterol steroid family. It is a fat soluble, extremely valuable with cell receptors everywhere from our brain to our toes. It's impactful in our gut health, every part of our human body, our immune system, our sleep cycle, our memory formation, all these things. So I think the lack of vitamin D is way more detrimental. And the amount of money our corrupt medical, scientific, and FDA, Human Health Services, NIH, they are pumping pimp money into their pet money-making drug research when we need tons of research on just the beauty and anatomy of the creation of each man and the physiology. So I'm just I love vitamin D, but I do respect that it should be measured. All right, Donna, I've received my systemic enzyme. I'm taking diltiazem, 120 milligrams one a day for supraventricular tachycardia, and it's working. My better half is on Eliquis, that's her husband, 5 milligrams 2 times a day, and for 8 days, and then 2 tabs once a day for deep venous thrombosis. We are not on any other medication. Can we take systemic enzymes? Absolutely, yes, you can. The human body makes enzymes all the time. We start losing it with aging, and we become prone to clotting. So, yes, I take a bunch of enzymes every day with my water on a low-carb diet, and I exercise, work out 5 days a week. Why? Because I don't ever want to get a blood clot. I want to slow my aging process. Catherine says, is Juice Plus organic? I've checked the packaging and can't find a reference to that. Catherine, yes, it is organic. In fact, Juice Plus is beyond organic. It's indescribable the amount of protection that goes into it. It's small farms all around. the water that is used to go into the irrigation of any of the fruits, vegetables, or berries that are used in the production of Juice Plus is monitored for toxins through spectrophoramorphic analysis. And then once it's picked, and they don't use pesticide, herbicide, or fungicide, once it's picked, when it's ripe, fully ripe, it's flash frozen. And those flash frozen samples are then sampled for spectrophoramorphic analysis of any chemical, pesticide, herbicide, or stuff. Then it's brought to the plant. It's quarantined and categorized, location, time, and date, and the farm. And then it is dried. And after it's dried, then it goes through another spectrophoramorphic analysis. And then after it's put into the encapsulated form, it's got another one. So it's got 4 points upon which it is studied. You couldn't get anything of higher quality. All right, and then the last page. Wow, did I do all those? No. All right, so I'm getting aggressive here. All right, Debbie says, what is adrenal fatigue? Its symptoms and how to correct. Also, I just purchased a far infrared sauna at ACAM conference. I use it all the time, up to 20 minutes, yet I don't perspire. Is this not normal? Lots of laugh. Well, Debbie, because I know who you are, and because you're my sister, and because I never sweat. Even when I was in the military on active duty and in the fields and carrying, 50-pound backpack, I'm telling you, Debbie, I never sweat. So I think our family is abnormal. We have an abnormal family. We don't sweat. So what's adrenal fatigue? Debbie, that is when you're tired. And your adrenals are overstressed from just a chronic sense of psychological, environmental, situational, or disease state stress. And your adrenals are not able to respond anymore. They've been so abused. When you do have an acute need for extra cortisol output, they can't do it. So that's adrenal fatigue. So, Debbie, we'll talk on the phone at home about your wonderful sauna. And I have my sauna too. But I tell you what, the more I live, I have to say I have been sweating in my infrared sauna. I'm in it 40 minutes though, sometimes more. And I check my temperature. I would check your temperature, Debbie, before you get in that sauna. Take your temperature orally, leave it in for a good minute under your tongue. And you should be 97.8, 98.2. That's your oral temperature. Then as soon as you get out of the sauna, recheck your temperature. If it isn't 101, the unit isn't heating you enough. And I think because your head is out of that sauna, it's important for your head and scalp to get warm too. So maybe you'll have to drop your head in the thing, Debbie. All right, Deborah says, my mother is 86 years old, in good health and very vibrant. She has suffered from chronic urinary tract infections for many years, and her doctors tell her she is now resistant to the antibiotics used to treat her infections. She's allergic to penicillin, but has tried all the other appropriate antibiotics, various supplements, special diet, and other treatment plans, but to no avail. Do you have any suggestions to treat an infection that has become resistant to antibiotics? Biggest concern for her and her doctors is that her kidneys will be adversely affected, akin with these infections. Thank you very much. Well, Deborah, I am going to tell you a large portion of what they call urinary tract infections are not urinary tract infections. Because girls, our urethra is real short, and then we have our labia, our skin, and our hair on our perineum, and we wipe, and then we pee, and that urine drains through the lips and the hair, and the urine samples get dirty. And a lazy doctor will just write there saying, oh, well, it's a UTI, take this antibiotic drug, and get the person out of the room. Cha-ching, charge it up, next person. So I am very aggressive in telling my patients, if I don't see a clean catch, and I can tell because skin cells will be dragged into the urine sample. You have to hold your lips apart and wash real well and hold them apart, and then you release the urine and it shoots right out of that urethra. And with the other hand and an open cup, you just go in and out of that stream. I just need a little bit. And that usually will cut back 50% of all what they call urinary tract infections. Number 2, you could use D-mannose. D-mannose is a type of sugar that's not absorbed in the gut, and it is concentrated in the bladder, and it prevents bacteria from adhering to the bladder wall to irritate it. So D-mannose. And then the other one is cranberry extract. Plenty of water, taking zinc, having vitamin D. And then natural hormones help with the bladder, and the DHEA helps with testosterone for bladder, Kegel, being able to squeeze your perineum and shut your muscles down there like you're squeezing to shut off your urine. And that tightening will help be dependent on testosterone levels to shut off your urine flow so you don't have wetness there all the time. That's what I would say, Deborah. Wendy says, hi, Doc. What causes ear ringing and how can I get rid of it? It seems to have gotten worse after I ate tuna a few days in a row. Maybe mercury poisoning. What else can I do? Help. Well, very often, all of us start getting hearing tinnitus, a high tone all the time, bilaterally. It should be kind of uniform. And this is associated with aging. As the tissues get dried out and the capillaries get diminished, that's why I like chelation therapy. It does lower the aluminum, the mercury, and all these things. It improves the microcirculation. Taking systemic enzymes are like little Pac-Men cleaning all that up. Never eating late at night. Getting a good pillow to support your head so you're not kinked. And outside of adequate hydration, exercise, these things, then you have to see your ear, nose, and throat doctor and go from there if you've done chelation therapy. Sylvia says, what do you think about the treatment for COVID with Paxlovid? Not much, since there's rebound to it. Is ivermectin a more natural way to treat it for mild symptoms? That's the experience I've had for years and years and years. We've been prescribing ivermectin, and when I was on active duty, hydroxychloroquine for my military soldiers that were, flying all over the country because I worked on the airfield. So I had to put my pilots on various things. And so these are so safe, so wonderful, so protective, antiviral, anti-parasitic. I would say my experience with all my patients here and with all my military experience, it was just fantastic. I would not touch Paxlovid with a 10-foot pole. Donna says she's received her systemic enzymes. Okay, I think we already talked about that. Yes, so that was a repeat question. Harlow says, Dr. Rita, how do I heal an eye sty? Can I use Argentin silver? Absolutely, yes, you can. In fact, I use Argentin every day of my life. I put drops of it into my eye. I squirt it up my nose. I will brush my teeth tonight. I will gargle with it and swallow with it. I squirt my face with a spray bottle just when my eyes feel dry. And that will help decrease the bacterial, fungal, and viral irritants there that are getting into the little meibomian cysts here. Moist, warm heat, and then a very low carb diet and systemic enzymes. And I think taking iodine orally, a tablet, the iodoral or Ithroid, 1 capsule a day, is excellent, and that should handle it all. I've seen the craziest things heal up with Argentin. And Catherine says, Doctor, you've expressed before that the clinician preference oil are far more superior than fish oil. Are your thoughts the same about krill oil? And if so, why? The answer is yes. And krill oil is a marine extract. We're not fish. We don't need DHA and EPA supplementally. I think, by the grace of God, my father was in food research when I was a little child in the 50s, and I saw them argue about the arguing occurring in research at that time about cholesterol and the cause of heart disease, because Eisenhower, the president, who I didn't know, died, but they were all talking about it. I was in my dad's lab all the time, listening to the researchers. And they were wrong about cholesterol and heart disease, and they hurt half a century worth of growing people and our cell membranes. They've hurt us. Now they're going to try and say that a human cell membrane whose only two essential fatty acids are linoleic and alpha-linolenic acid, we actually need EPA and DHA. Well, I'm sorry. We're not fish. We don't live in a 29-degree water up in the northern Atlantic or the near the Antarctica areas. We don't live in 50-degree water. We don't live in 70-degree water. We're 98.6. Even animals, fish that are in the Caribbean have far less omega-3 and omega-5 and omega-6. EPA is 5 double bonds. Docosahexaenoic acid is 6 double bonds. You don't see that concentration in Caribbean fish where it's warm water. Anyway, absolutely. Krill oil is marine. We don't need it. And my understanding is that Udo Erasmus, who created that company, sold it out to the big people. That's my understanding. And that it has become controlled by the food corrupt systems. All right, and then last page here. Hello, Dr. Ellithorpe. I know it's normal for blood pressure to fluctuate during the day and night, but I've been having some really extreme swings. During the day, I have a systolic varying from 130s to 190s. My diastolic never goes above 80. What are some of the possible causes and ideas on natural treatments? Thank you, and God bless you for all you do for us. God bless you, Carmen. Well, eating can have an impact on it. Stimulants such as green tea, caffeine, soda pops, sugar, being mentally upset, being dehydrated, whether you were or not exercising. We all have a normal rise in the morning from the stimulation of our dawn effect, the morning effect of cortisol on us. So that can, but to be a 190 systolic is something you should share with your doctor, follow up, and see the direction that that's headed. And but I would say blood pressures could easily vary, up to 160 for a short time systolically, but they really should not get up into the 190s. So I have that checked out, Carmen. Josie says, I had an abdominal ultrasound done, and they found a cyst on my right kidney. Most of us, the older you get, you will have cysts found everywhere in your body, your liver, your kidneys, all around. On my right kidney, and that I have a fatty liver. That means you've been eating consistently too many carbs on a low-grade basis, and you have strained the cell metabolism of your liver detox system, and now it's just depositing fat. I also have iron overload. I'm not sure if this is caused by fatty liver. Would EDTA chelation help to remove the iron overload? The answer is yes. And how much is this procedure, and do I need Dr. Mitchell to prescribe? Yeah, it has to be ordered by a physician who's trained in this. She's trained in it. And you have to go low carb. You just have to face that. You've been raised in a carbohydrate international crime syndicate, pimping sugar and fruit sugar and high fructose corn syrup to you, even in your salad dressing, and you've been hurt by it. And you have to take an aggressive stand to start doing some fasting and to not succumb to this anymore. And then do some chelation, do some exercise, drink your water, never eat past, say, 6 o'clock at night. Josie said, oh, that was Josie. Linda, the last one is, I seem to have lots of cysts in my body. I had a cyst on my ovaries when I got my mammograms. The technician said It was hard to decipher. They were so full of anything I should be worried about. Is there something I can eat or take that will dissolve these? Are they hormonal? Well, I don't know how old you are, Linda, but glandular tissue has cysts. But the older we get, bodily cysts develop because our elastin collagen between tissues starts breaking down. We don't have enough vitamin C. We don't have enough collagen, elastin, or hormones for repair. And so things bulge out. We start getting aneurysms. We start getting the cyst is, maybe a pound of weight, and then it's hanging there. And then the tissues are pulled out just like any wrinkle in your skin. Your little kidney is strained just from you walking, and a little tissue will come apart, and eventually a little cyst will form. So we're iodine deficient. That's also important in breast tissue and other glandular tissue. I would take iodine. I would be low carb. I would do fasting times. I would do intermittent fasting. I would drink plenty of water. I would never eat past, say, 5:30, 6 o'clock at night. I would take systemic enzymes, iodine, vitamin D, a good multi-mineral, and a B complex, good multivitamin mineral thing. That's what I would do. Let's see what we have here on our YouTube chat. And let's see if we can't put a few minutes in here. Thank you, Dr. Rita. Appreciate that. That's a kind statement. Jennifer, thank you. Azar says, hi, Dr. Ellithorpe. She says, beautiful, Dr. Ellithorpe. Thank you, Azar. Hashimi, thank you. My left foot is much colder than my right one. I am 72 and your patient. My blood sugar is A1C are fine. I did some research, learned it's due to a lack of blood flow and low. Oh, do some chelation, Hashimi, Azar. Please get some chelation and take some enzymes and follow up, but do EDTA chelation. We have had ulcers of the toe from lack of circulation or poor circulation, diabetic ulcers that won't heal, and they've healed and they've prevented amputation. So we know it works. Christina, all right. Wow, thank the Lord you recovered. Oh, that's about when I was 15, 16. Yeah, I almost died. It's weird. All right, Christina says, thank you for always giving your time. God bless you. Question, does EDTA chelation therapy help detox those who have been around fuel and fumes? Absolutely, absolutely. Especially pilots and crew chiefs and flight attendants and all those people, the fumes and the heavy metals that are in these JP4 jet fuels, my goodness, yes, please get a challenge, get a measurement, see a doctor, acam.org, acam.org. Yeah. Aaron says, what is your opinion of rapamycin? Well, there's a lot of research about that and cell metabolism, anti-aging, and so forth. It's too complex for rushing through at the end. Bring that up sooner in one of these emails, and I'll talk more about it next time, Aaron, okay? Christina, I have to get a wisdom tooth pulled soon. I have to take amoxicillin for the infection. Should my vitamins... what should I do? All right. Well, I would make sure you're on your D. I would use Argentine silver as your swish and swallow 3, 4, 5 times a day after that's done. I would fast before the surgery, if you can, up to 24 hours. And I would fast after the wisdom tooth is pulled for at least 24 hours. Why? Because that stimulates human growth hormone and healing much better, faster, quicker. So there you go. And I would take zinc as well, and the Argentine silver swish and swallow. Harlow says, can you repeat the joke that you laughed so hard about last week? It was great joy to see you laughing so heartily. It was about the invisible man. So what did the doctor do for the invisible man who came to see him? The invisible man goes to his doctor and says, I'm invisible. Can you help me? So the doctor said, yeah. And he brought him to the ICU. It was just so funny. And was there another one? I can't think of it now, but I have people waiting on me to escort me home. So I'm going to have to close. I enjoy so much being with you. God bless you all and help us all to live in service to one another. And I want to ask you to like and subscribe if you can. Share it with family and friends. Please leave a comment and look for your email notification. Put your little note in there on the link there. And we'll see you next Tuesday. God bless you. Take care. That was so funny, wasn't it? All right. Bye-bye.